Infectious epidemics have occurred all over the world for centuries. From the bubonic plague of the mid-14th century to the 2015 Ebola virus, these infectious diseases have killed millions of people. Now, although the new epidemic, known as the Zika virus, is not as dangerous as maybe the Ebola or the bubonic plague, it still has some pretty nasty symptoms that you won't want to occur. So there are a few ways that scientists say that you can avoid contracting this disease, and I'm going to share a few of those with you today. Now, according to abcnews.com, the Zika virus epidemic began in Brazil in 2015 and now has made its way into the United States. So it is mainly spread by the bite of the Aedes mosquito. And so it's transferred through the blood. However, new studies are beginning to show that it can also be transferred through other bodily fluids, such as your urine or your saliva. So it is thought to also be a sexually transmitted disease. Now, although scientists don't really know yet if there's enough in the bodily fluids for the disease to actually transfer from person to person, according to CNN.com, researchers are highly recommending that people who travel to countries where the Aedes mosquito is, that they take serious precautions when returning to the United States to make sure that the disease does not spread. Now, especially the people who the scientists are saying don't need to catch it are pregnant women. So they're encouraging all men that return to the United States after visiting countries where the Aedes mosquito is prominent to use protection during intercourse, and also to wear bug spray for at least 3 weeks prior to their return. So you may be wondering why it's such a big deal for pregnant women to contract the symptoms. Well, according to abcnews.com, scientists have discovered that there is a connection between the Zika virus and microcephaly, which is a disease in infants that causes a small head and a small brain, which can lead to mental illnesses and retardation and slowing of learning capabilities for children. So, although there's no cure or vaccine for the Zika virus, abcnews.com gave us great ways to avoid contracting the disease and to avoid spreading it in case you've already contracted it. So the Zika virus is said to cause a mild fever, a skin rash, conjunctivitis or redness of the eye, muscle and joint pain, and a headache. Well, those are common flu symptoms, so don't seem, that serious until a pregnant woman becomes contracted and it ruins her child's life. Okay, so there are ways to avoid it and contain it. I've mentioned a few. I've mentioned that you should wear bug spray if you travel to any of the countries that are prominent with the mosquito, and you should use protection during intercourse if you've traveled to any of these countries. But also, you should always use bug repellent when going outside now that it's possible that the mosquito is in the United States. Also, the U.S. Centers for Disease Control and Prevention have issued a country list. It's got 32 countries. They include like Puerto Rico and Brazil and Guatemala and Mexico. And they are discouraging people to travel to these countries. And they are discouraging all pregnant women, period, to not travel to those countries. And if you do have to, for any reason, travel to those countries, you must wear bug repellent. So, following the safety guidelines that I just told you, you can avoid contracting the disease and you can avoid giving it to others. So wear your bug repellent, avoid traveling to the highly infectious countries, and practice safe sex until you can stop this epidemic. Now, one person can't do everything, but everyone can do something. So follow these safety guidelines. Thanks.